Yes. Hey, I am Adam Bryce Weinfeld here at Austin Plastic Surgeon, and today I'm really excited to discuss with you a particular patient on whom I recently did a deep plane face and neck lift. The reason I want to discuss her is because there's a couple of unique features about her and her recovery that may relate to some of the patients out there who are interested in this procedure, trying to decide if it's the right thing for them. So let's take a look at her preoperative view here. Now, when you look at this woman, she's 50 years old, and in some ways, she looks her age or maybe even younger than her age. And so the question one might be asking is, why even have a facelift? Well, the desire and the need to have cosmetic surgery, especially cosmetic surgery on the face, really relates to what the patient wants. And she knew that she looked good. She was very happy, but she felt like she was starting to age. She was starting to look a little bit older than she wanted to. And we can see that in subtle ways. She has a deep nasolabial fold here. Her cheeks have started to slide a little bit forwards here. And then she's got some early pre-jowling here. Now, I should mention also that this patient wanted to have a rhinoplasty. And I don't always combine a rhinoplasty with a facelift, but in her particular case, I made what I would consider a little bit of an exception, because it made sense for her, and procedurally it didn't get in the way of having a great result for a rhinoplasty and a great result for the facelift. Let's see that next slide. Okay, so now that we're looking at the side view here, we start to see some of the aspects of her face that did bother her. And we can see here that when we look at her neck, she was losing some of the definition along her jawline. And then you can also see that she developed a little bit of a really miney turkey gobbler appearance here, a little bit of excess skin in the neck, and her cervical mental angle wasn't as sharp as she wanted to have. Now, you're going to be blown away, at least I think you will be, on her post-ops, and they're really short-term post-ops, and how we've really transformed that region. Also, it's kind of subtle, and she wanted us to hide her eyes, which of course we're respecting, but you can see how the mass of her cheek, so the central mass of her cheek has kind of slid down and is kind of crowding her lips, creating that deeper nasolabial fold. So next slide. All right, so this is just a little bit of a schematic photo that I wanted to briefly use to talk about what we do when we're doing a deep plane facelift. Well, first of all, what is the deep plane? Well, the deep plane is a space not beneath the skin, but beneath the ligaments, beneath the muscles, beneath the denser connective tissue that lies underneath the skin. And the way that we can use the deep plane is so powerful. When we do a facelift and we're relying somewhat on the SMAS, which is that deeper tissue, but also on the skin for the lift, we don't get quite as profound as a lift. And also, we tend to have bruising and swelling for a longer period of time. When we do a deep plane facelift, what we do is we undermine just a small amount of the skin, both in the anterior face and the mid face and then around to the neck. But then we enter right at about this level into the deep plane, and we get underneath that deep plane and we release ligaments in different locations that hold the tissues lower, that restrain our ability to really lift those tissues to a position of youth. So next slide. All right, so this is her after the procedure. And what I want to show here is that, and we'll do a side-by-side comparison, is that you can see a couple of things. One is, with our patients, they don't really require a big compressive wrap. We don't need that. And the reason we don't need that is because in the surgery, first of all, we're very gentle. We really are careful about how much fluids we give the patient. So we're not relying on external pressure to prevent a lot of swelling. And then the deep plane facelift really allows the lymphatics of the skin to stay intact, and all of that swelling that would otherwise accumulate drains into the deeper plane and exits the face in a way where we get less swelling, and the swelling that we do get, it resolves much sooner. So I wanted to show that there's a pretty mild dressing here. We don't see a lot of bruising out onto the cheeks. And we do use drains, not always, but we do use drains that are very helpful to come out pretty early. So let's see that next slide. All right, so what I wanted to show here is that we can already see some changes. Now, of course, she's swollen, and and that kind of affects what we see. But I wanted to show a couple of subtle things. the nasolabial fold here is already less prominent, and now she's not smiling here, right? She's not smiling. So she's not using her facial muscles to lift the cheeks the way that she is here. So in a not smiling appearance, you can see that her cheeks are in the same or even a better position than her preoperative state. So you can see how powerful that deep plane was, that deep plane work was, in really elevating the mound of the cheek to give that more youthful, more almost heart-shaped appearance to her lower face. Let's go to that next slide. All right, so I just wanted to show this, and the reason that I wanted to show this is this is a photograph that the patient sent to me, and she's at about 7 to 8, 9 days after the procedure. And what you can see is that already her jawline is much more crisp. I mean, it is so crisp, it even looks like it's been altered a little bit. But there's a photograph she sent to me. She swore she didn't do anything to it. We have our own postoperative photographs that demonstrate that. And you can see that she's got just a minimal amount of bruising on her lower face here. She did have the rhinoplasty, so we have just a little bit of light tape on that. And then let's see that next slide. All right, so here she is, giving us a photograph of herself again, roughly at the same time frame. And you can see how she has that much better cervical mental angle here. And she's got a much crisper jawline. You can really see it all the way out to here. And this is like just 7, 8, 9 days after surgery. And so that's even with swelling present. You can see we don't have bruising out into the face and almost no bruising into the neck, just a little bit along the area around the ear. Now, you can see the incisions, okay? Again, we're just barely beyond a week, but I want to show you how that plays out when we get to the 2-week view. All right, so here's another photograph that she sent us, and this is roughly at 2 weeks, a couple of days. You can see how her nose looks a lot prettier. And then again, this is what I really wanted to show you. One of the things that really bothered her is that, even though she didn't feel like she was looking really old, she really wanted a jawline that was nice, crisp, that had a really nice, distinct line that really separated her face from her neck, and again, a better, deeper cervical mental angle. Let's go to the next slide. So here's our side-by-side, right? So here's our side-by-side one. We really see a nice change in that nose, right? We see a nice change in the nose. And then what else do we notice? We notice that the mound of her cheek in this postoperative photograph, it's more elevated. It's really spread up and out over the upper lateral face, giving a heart-shaped appearance when we see from the front. And then also the nasolabial fold is really improved. We don't see it as deep here. So, here, her pre-photograph, that cheek really has slid down and forwards. Whereas here, again, repositioned higher up onto the cheekbones. And then also, I think this speaks for itself. That little bit of early turkey gobbler that she had that was really detracting from her jawline, that really has been improved in a very significant way. So, when I look at this, I see a younger woman, but I also see a thinner woman. I mean, that's kind of what I'm looking at. She didn't lose any weight. She just we redistributed the volumes of her face to make her look more youthful, but it also has the side effect of making it look like she's lost weight. Let's go to see that next slide. All right. People often ask about where the incisions are, what scars will look like. Okay, so I will tell you, this patient sent me a text at about 2 weeks and said she mentioned she barely took any pain medication. I think she took 1 pain pill. That was one thing. She also said, I barely have any bruising or swelling. And this is these are both photographs of her, and you can see there's barely any bruising, just a little bit of swelling, a slight degree of redness. Now, of course, we do see the incisions. We see a little line here. But the incision that goes all the way up onto the side of the sideburn, very difficult to see on that close-up, and they get really hidden well in these contours here and around here. Now, and again, this is only at 2 weeks, so hair down or even just a little bit of makeup, that'd be very difficult to tell that she had a surgery. I want to use that photograph, but I've drawn these lines in here to show people where those incisions would be. So, the incisions for the deep plane facelift are going to come up along the sideburn. Now, some people put the incision up behind the sideburn. I don't like doing that. And the reason I don't is that can displace the sideburn higher up. and create a very unusual appearance of someone not having a sideburn. We come to recognize a face as normal when we have a sideburn. So, patients can get a little bit worried about, well, is someone going to see this incision? And in most patients, it's very difficult to see. I think in some later segments, I'm going to show you some post-operative results at a couple of weeks, couple of months, even at a year. You'll see it's very difficult to see. But anyway, the incision goes along the hairline, and we place it just a couple of hair follicles into the hairline so that when we're really lucky, hair follicles grow through the scar and really camouflage it, disguise it. We come back up, make a little peak here, then along the ear here. And the width of here to here depends on the patient. We call this area the helical root. And from where her helical root began to where it ended, in her it was actually a little bit interesting, a little bit wider. Typically we would have this incision a little bit further back, but her anatomy is what her anatomy is, and so we got to respect that. That's the best location, is that transition from the face skin to the ear skin. And then we make an incision that pops back along here. This is called the tragus. So when we make the incision along the transition of anterior tragus to posterior tragus, this area along here, we call that intratragal, very well hidden. So we made a little intratragal incision here, then we pop back out to the first little tiny crease in front of the earlobe, and then back around the earlobe. Well, what do these little dotted lines show? That shows where the incisions are behind the ear. So, incisions behind the ear are free incisions for the most part, right? Very difficult to see. The ear hides a lot of it, so does the hair. They're really important to make as good as we can. But the reason I point out about them being kind of free incisions, I'll get to that in a second. But the incisions go behind the bowl of the ear, the concha of the ear here, really hidden in that crease, that post-auricular crease, and then they go across what we call the mastoid at a point where the ear is going to hide them the most, and then a little bit along the hairline, and then back into the hair. And we do it in a way that preserves the hair as much as is possible, and then also we avoid a notch whenever possible in the hairline. So I wanted to show that example of the incisions. We're going to do another close-up here. Okay, so I point this out just so you can see a little bit better. All right, so we've got the incision around the sideburn, then we have that incision just above, or rather just in front of the upper part of the ear, the intertragal incision, and then we have this incision just in front of where the earlobe attaches, and then these are incisions behind the ear, which, remember, I called them the free incisions, right? These are free. They're very difficult to see. There's not a lot of scar burden from them. And why am I making that point? Well, the reason I'm making that point is that a lot of patients come and they say, I want a short scar facelift. And that's a very reasonable and valid operation. But with a short scar facelift, you make all of these incisions here, but then you kind of don't make any of these incisions behind the ear, or you make less incisions behind the ear. And that does create some limitations. You're really not able to get down to the neck quite as well, or if at all. You're not able to really create that really sculpted jawline and that really beautiful neck with beautiful neck anatomy and definition. So, this is kind of a little bit of a message to those who really feel like a short scar. It has a really sexy name, but it doesn't really provide everything that everyone is looking for. There may be some patients for whom it's appropriate, but really when I like to do a deep plane facelift, I use the same scars that you have for a short scar facelift, but I just give a little bit more of these free incisions here, free because you really don't see the scars quite as much, and you get so much more power when you're dealing with the neck, which of course is a deep plane procedure as well. I don't think we have any more slides after this. I think we're done. I hope this answered a lot of questions, and we look forward to giving some additional segments later where we go over some other patient examples and really talk through what we're trying to achieve with those patients.